Welcome back to Radio Entrepreneurs, the reformulated version for the dramatically changing economy. And again, the majority of people in the United States and New England and Boston are still working. We're trying to keep everyone still employed. And to do that, we are adapting to what's been going on. And we appreciate all the listenership and how the viewership is going up. Our next guest, Jared Taylor, co-founder and CEO of BlocHealth. Welcome.
Thank you. Thanks for having me.
So I guess BlocHealth is pretty busy. So why don't you tell our clients or our listeners what you've been doing?
Yeah, so BlocHealth unlocks healthcare professional data, making it easily shareable. So we focus in on tasks like credentialing, which is the verifying of healthcare professional information, and getting them like state licenses. So this is a really good actually time for us just because of the growth of telehealth, and that's been a big focus for us. So we help these healthcare professionals get state licenses in multiple states so they can provide telehealth services. And we also help them get verified so they can start work and get enrolled with the insurance plans to be able to provide care to patients.
So tell us how your business has changed over the last 4 or 5 weeks.
Yeah, I mean, we were working in an office, so now we're working remote. We were kind of already planning to go this route because we were already doing a mix. And this was a good experiment for us to kind of take this full time. But yeah, business has been, if anything, in a positive way, right? Because of the growth of telehealth, we've been affected, which, feels weird seeing how lots of businesses were affected in negative manners based on COVID-19. But yeah, I mean, it's been relatively solid for us. I mean, obviously, medical practices, which was a area where we did focus in on, that their growth is not great right now. They're being, either they're going to shut down or they're not going to be as prominent in the healthcare space. That's not good for us. But there's ways we can help work with those type of medical practices and, help get them back on their feet after things start to slow down with COVID. But yeah, I mean, it's been an interesting kind of journey for us right now, and we're just trying to get in touch with as many telehealth companies as we possibly can and provide services to them.
This morning I was on a call earlier and there was a healthcare provider and he was saying that he's expecting a major shift in his private practice, that the practices are going to go more virtual and virtual visits and drive-by outside visits. So he was saying he's expecting an increase long-term in business, but it's going to be different, less face-to-face meetings.
Yeah, I mean, there's a company called Doxy.me that helps people like start telemedicine practices. DocSpace is another one that's helping them. So yeah, that it's really different. I have a podcast as well, and we had the founder of Teladoc, Michael Gorton, on the other day, and he was just talking about how it's crazy to see how much telehealth has grown. So it'll be definitely, bless you. Bless you. It'll be interesting to see, how things change. I know for the practices you're talking about, them adapting, this could be, still a way for them to be able to move forward, but unfortunately, not everyone will probably have that opportunity. So it'll be interesting to see how it affects them.
So what are the biggest challenges you're facing today?
I mean, we're still a relatively small team. There's 4 or 5 of us working on this. Trying to get in front of as many people as we possibly can. We can handle every business opportunity that comes our way. We've really built an automated platform. It's continuously getting in front of the right people in the healthcare space. It's about selling, but you can't sell like you used to sell during everything going on, right? You need to sell with compassion, and you need to be understanding that, timelines can be affected, and maybe people don't have the budgets that they had in the past for software as a service. So it's just being compassionate, which I never tried to sell before either. I try to just provide value where we feel we can provide value and then go from there.
Right.
Yeah.
Right. Do you expect things to change in the next 60 to 90 days?
I mean, I think you keep seeing things get pushed back as far as when people can come back to work. which will continuously drive, at least in this case, telehealth adoption. People don't want to go into the many types of clinics or into the emergency room unless they're really, really sick. So, I mean, telehealth will still go strong for the next 60 to 90 days. It'll still go strong after everything that happens. We are going fully remote. So we've made that decision as a company. So that's something that's happening for us in the next, well, right now, but in the next 30 days, we will be continuing that. But I mean, it hasn't affected us so much in the sense that we adapted maybe a little sooner to a remote type of situation than we were actually going to.
That's somewhat interesting. I myself canceled my doctor's appointment this week. I didn't want to go to the hospital for a checkup. I stayed away. At some point, I'm going to have to go for a checkup and get monitored. A lot of people are doing a lot more home checkups. That's one of the things that doctors have been talking to me about people, not me in particular, but people in general now getting more stuff, doing it in their home and then reporting the data to their doctors. Again, do you see a lot more changes that you're trying to anticipate? Does that change the way you staff and train your business too?
No, I mean, we actually, for many of our hires, we did totally remote. We found people that we trusted through a prior connection. We did multiple phone interviews, video interviews, really got to know them. And I think we were always preparing for like the workforce to kind of go this way. So it didn't hurt us as much, but we had to invest in some more remote tools. So we use like a tool, Monday.com, which is, I advise every business to use it. It's absolutely incredible. It allows you to set all your project management, kind of see what everyone's working on so that you're not giving them too much work, all your deadlines, everything you could possibly imagine. They just launched a couple new features. Having that tool allows us to easily work remote. So I'm very thankful for that. And just trying to leverage these type of video calls to still keep a really good team atmosphere, which that's the toughest part of working remote. It's, you're not with everyone every day. So how do you still build that rapport and have that good relationship with everyone on your team? That hasn't been a challenge for us, but it's been different, right? Video chats, phone calls, lots of them, and trying to limit meetings at the same point.
We've been speaking with Jared Taylor, co-founder, CEO of BlocHealth. Jared, if somebody in the community needs to get in contact with you, use your services, how do they find you?
They can add me on LinkedIn, do Jared S. Taylor. They can feel free to send me an email. It's just Jared, Jared, at BlocHealth.com. I'm pretty responsive there. Same as LinkedIn. If someone adds me and they just leave a note in the ad, I'll answer them back and we can connect.
And you'll connect to all our social sites so that people can find you through us as well, we hope.
Absolutely.
It's been great talking to you today. We hope you come back because we know there's going to be more changes in the industry. So we want to keep up to date on that and keep our listeners informed.
Absolutely. Thank you for having me.
Thank you for coming, and good health to you as well. We look forward to speaking to you again. Remind everyone, this is Radio Entrepreneurs.